talk about President Joe Biden. Yesterday, the United States President called for a patent waiver for COVID vaccines to speed up distribution to poorer countries. And the UK government are not keen on this, and certainly the Germans have spoken out about it. Let's talk to Dr. Mohga Kamal-Yanni, who's a global health expert at the People's Vaccine Alliance, and joins us now. Good morning to you.
Good morning.
Now, the People's Vaccine Alliance, so what are you calling for there?
Well, we're calling for maximization of productions of vaccines so that everybody on the planet can have access to the vaccine rather than the huge inequality we have now. So in order to achieve that, we have to share the technology and waive intellectual property rules on technologies related to COVID, so vaccines, medicines, and other things.
And now the thing is that, from what I can understand from the British Pharmaceutical Association and others who've been speaking out about this since, is that it's not an issue in terms of the patents, particularly at the moment. It's an issue in terms of the expertise in making these vaccines. It's not, you can't just sort of convert a milk factory into making vaccines overnight. The expertise that's needed, but also a shortage around the world of some of the key components, some of the key ingredients for these vaccines, and actually, getting rid of the patents, saying a free for all for everybody, may actually lead to fewer vaccines being rolled out because everybody's only got a bit of what they need. The price goes up, and actually it gets harder to deliver those vaccines. Isn't it better to keep the vaccine production in the hands of the people who know what they're doing, and then roll them out to countries around the world as that comes off the factory line?
Actually, this argument is absolutely flawed. It assumes that people who know what they're doing, as you call them, is just a bunch of pharmaceutical companies that are based in the US and in Europe. In fact, there are many pharmaceutical companies in the South and developing countries who are capable of producing vaccine. Do you know, this is like deja vu for me. We had exactly the same argument at the time of at the height of the HIV, and I hear the pharmaceutical industry talking about, you will have low quality, that they were worried about quality, which is like made me laugh because it's exactly what we heard before.
And we know that a lot of
assumption is wrong. Okay, there are companies that can produce good quality vaccines.
Yeah, and there's certainly in India, we know a lot of the vaccine production coming to Europe actually is coming from India, though again, I think Britain has waived some of the vaccine we're supposed to have. Obviously, India needs it more than us right now. There is a big issue, though, in terms of intellectual property rights. Certainly with AstraZeneca, the Oxford vaccine, they're selling it at cost, not making a profit. Some of the other big companies, Pfizer, BioNTech, Moderna, and others, making Johnson & Johnson their Janssen vaccine. There'll be huge profits to be made from this. But the reality is, huge amounts of expertise and billions of dollars have gone into the development of these vaccines, often by private companies, often with government investment as well. But we know that there are huge numbers of products that are developed that cost billions of dollars to develop, which never make it to market. The pharmaceutical companies make their money on the few that do actually come to market. They've developed the vaccine. Don't we want to keep that profit motive there? We just pay the cost. It's a small price to pay compared to shutting down the world economy and losing millions of lives, in which case it's a small price to pay.
Are you saying it's a small cost to pay if billions actually of people in developing countries are not vaccinated? And it's a small cost that all these billions, can die.
No, I'm talking about the cost. No, I'm talking about
That is
Mohga,
the real
that's not what
that was not what I was.
I was specific.
Mohga,
I didn't mean it. So, and you knew I didn't mean it, but you said it anyway. I don't mean that. You know perfectly well I didn't mean that. I mean in terms of the actual cost. Part of waiving the patent is that pharmaceutical companies can't make profits. Pharmaceutical companies making profits is why they exist in the first place. So we need the profit motive is what drives them. Are you saying that we would actually be able to roll these vaccines out to far more people in far poorer countries far quicker if we did get rid of the patents?
What I am saying is that first, the COVID vaccine showed clearly the stimulants of innovation is a public funding. Don't forget, the vaccines were not made last year. The vaccines are based on 20 years and more of research in universities that was funded by the public, by our tax. And last year, the governments just poured money on research institutions and on pharmaceutical companies, including on manufacturing. So companies were manufacturing with no risk. We have taken the risk. So that argument is not correct. The fact that there are more patents if you follow the patents over the last few years, you will find more patents filed, but less product. That curve of going up has not been matched by a curve of products coming to the market, products of therapeutic value. You get more of me too that don't add any therapeutic value, but they add profit. So the profit incentive is good enough to produce more profit, but it's not good enough to produce the product that we need for our public health in the whole world, but especially for developing countries.
Okay.
Diseases are ignored in terms of research because they don't make profit. So
well, indeed, pharmaceutical companies don't actually look at vaccines. That's not where the money is normally. They spend the time looking at products they can give us, which we can all take for, statins that we can all take for decades and decades, and rather than vaccines saving lives. Dr. Mohga Kamal-Yanni is global health expert at People's Vaccine Alliance. Really appreciate joining us. Fascinating conversation. Love to speak to you again on a day we haven't got election results, so we can spend more time with you. Thank you for that.